Hi, I'm Roger Frost, and I'm here again with Jeff Kircher, who is the pharmacy manager at Vienna Drug Center. Jeff, we were talking previously about an analysis certificate, and it sounded like we were talking about a 100-page document. Where do you find this analysis for any particular version of CBD?
Sure. Certificates of analysis can be anywhere from 1 page to 5 or 6 pages. If it's a 1-page analysis, I'm a little leery on that. There's some analysis that I've seen that have been out there that say no visual mold, mildew, or residual solvents. How do you see that? Are you holding it up and just saying, yeah, it looks okay to me? Those kind of certificates of analysis, even though they have one, I would stay away from.
So if I'm coming into your store now and say I need some CBD oil, but I want to see the analysis.
Absolutely. And I would ask that question. If you're buying it online, again, not something I would recommend, but if you are buying it online, I would call that company and ask them, what is your certificate of analysis? Where do I find that? Is that certificate of analysis lot specific? I want to know what's in my bottle, not just in what the company says we made 5 years ago. I want to know what's specifically in my bottle that I'm picking up right now. And if they can't answer those questions or tell you how to find it or send it to you, I would walk away.
Now, there are lots and lots of bottles here. Is it the same certificate for all of these? Or?
No, that's the wonderful thing about the company that we have here. This is called Ananda Professional that we sell, and each one is lot specific for each individual bottle.
Oh, wow.
So this bottle is a THC free bottle, so we were talking about THC in here. This one is what's basically called a broad spectrum, so it covers all the other cannabinoids but minus a THC. One reason why that could be important is if you work for the military or the government, you can have some false positives when it comes to drug tests when taking these products. Because THC can build up in your body depending on what your metabolism is and give you a false positive for that. But each bottle should have its own individual certificate of analysis.
So it sounds really like we should come to a store rather than to buying it online.
Absolutely. That's definitely what I would recommend. Whether you get it here at Vienna Drug Center or you get it from another pharmacy, I just want you guys to be safe. That's the most important thing to me. And making sure that there aren't any drug interactions with any medications that you're taking. That pharmacist has gone to school for many years to learn about that, and they will know.
Now, when we were coming here, it was kind of an interesting trip. We made a few wrong turns, etc. So people coming in from, say, the west part of Loudoun County for this, do you do it by mail?
I believe that would be something that would be possible. Like I said, it is legal. It can cross state lines. It could go in the state. One of the things would be the mailing expenses for it. So whether we use UPS or FedEx to do that, that mailing charge would be passed on. But yes, that should be something that could be done here.
Okay, at the end of our session, I'll put on the screen how to contact
Absolutely, thank you.
Talking about CBD oil now in a more general way, what other kind of conditions can it be used for? I mean, we've been talking about ALS, which is of particular interest to me. What other conditions does it?
Sure. They don't know all the different things that it could help with right now. So there's a system in our body that's called the endocannabinoid system. And what this system does is it's kind of like a master control that helps to regulate our body, whether it's temperature or our motor control, our sleep, our pain levels. So think of this endocannabinoid system as that master control, and it's helping to create balance or homeostasis in your body. Talking to you today, I'm a little anxious. I might get my heart rate up, my cortisol levels are going up, and I might be a little more jittery. My endocannabinoid system is actually kicking in, and we naturally make cannabinoids, endocannabinoids. One is called anandamide. And those levels will increase and create a balance, which allows me to talk to you and to all of you out there for that. Without this, sometimes we might have more anxiety, or we might have spasms, We might have trouble sleeping, or we might have problems controlling our pain. Lots of different things that this endocannabinoid system is treating or is affecting, and they don't know all of them yet. Unfortunately, it's something that is not studied a lot in schools. So your pharmacy schools and your medical schools, if you go to your physician and ask them about the endocannabinoid system and how CBD works, most of the time they're going to look at you and say, I have no idea with this, and they wouldn't be able to recommend a CBD product because of that. So it's up to us as pharmacists and you guys to find out as much as you possibly can about these products. I studied about a year looking at the different studies and how the system works in our body before I felt comfortable in carrying this product, because I wanted to make sure that I could protect the public. I wanted to make sure it was fine. It was a fine product to carry. With that being said, if your system is out of whack and those natural endocannabinoids that you're actually making aren't able to bring you back into balance, whether it's sleep or spasms, motor control, that's where the CBD would come in, and the cannabinoids that we're talking about here, CBD being the cannabidiol, will help to bring that balance back into the body. And theoretically, that helps you decrease the motor spasms that you could be having. It could increase your quality of life. Many different things that could be helped by this.
Now, earlier you talked about dosage.
Correct.
How do you know what dose you should be taking?
That's a very complicated question. It all
That's life, isn't it?
Yes, it is. Yes, it is. So it all depends on your metabolism. The CBD oil can stay in the body anywhere from 9 to 72 hours, depending on how you metabolize it, which means that you could start at that 10 milligram dose that I recommended. And again, with this product, you're talking about an oil, or you're talking about a capsule that it comes in. The oil, you would start at a 10 milligram dose. The capsule is actually a 15 milligram dose. The reason why this one is higher is because you're actually swallowing that capsule, and it's going through what's called the first pass through the liver, and you lose about a third of the CBD oil in there. Whereas with the oil itself, you're able to take that oil, and it's what's called a sublingual dose under the tongue. Now, as an ALS patient, that might be a little difficult to do.
I have a helper.
Yes. But sometimes it might be difficult to put it under your tongue and leave it there.
Yeah.
In that case, if you started using this and you were fine with putting it under the tongue, and then all of a sudden you can't, you could increase that to the 15 milligram dose and just swallow it, and it's going to work that same way. You'll still have that first pass.
So, remind us, we've got a 2,000 milligram concentration.
Correct. So that's the concentration that's in the entire bottle.
Okay.
So always look at what that total number is and how many mLs are in there. So 2,050 mLs, which means that it's 40 milligrams per ml in there.
Gotcha.
So what we talked about was starting dose of 10 milligrams for everybody for that. But that doesn't mean that's going to be it for you. So because of your metabolism, one of the things that I recommend doing is keeping a journal. Look at how you're feeling. How is this helping with your spasms? How is it helping with your sleep? How is it helping with your caretaker's anxiety? If your caretaker is taking this, it could help with that anxiety as well. Keep that journal, and every 3 to 5 days, say, okay, my anxiety level is a 5 right now, and that's just not good enough. I want to be a little less anxious, or my spasms, I don't see a difference yet on this. After that 3 to 5 day time period, you could add another dose. So whether you're doing it, I recommend starting it at bedtime, and then after that 3 to 5 days, you could start a morning dose. And so you're taking that 10 milligrams at bedtime, and then you're taking 10 milligrams.
So that's twice a day.
Correct. I have some patients that are going ahead and taking 30 milligrams 3 times a day,
Whoa.
depending on what they're doing.
Yeah. Now, we're coming to the end of the session. Is there anything that you think we need to know that we haven't talked about yet?
The doses are completely unique. So everything that you're going to be doing has to be unique to you, and it's going to be different from your friends and from your coworkers and from your caretakers. So there is no magic dose for your weight or for your condition that you're dealing
Okay, Jeff,
with.
there was something else you said you wanted to tell us.
Yes. So when we're talking about dosing, it's specific for you, but you can take too much of it. So it's not
You can OD?
well, you can't OD on it, but you might not get the effects that you want on it. So say you're taking that 30 milligrams 3 times a day, you might feel as if you weren't taking anything. So there is a bell curve, basically, not just a dose that keeps going up. The more you take, the better you feel. It's actually a bell curve that the more you take, it's going to be like you're taking nothing. So if you ever get to the point that you have increased it after that 3 to 5 days, and you're saying, you know, I'm feeling worse. I feel that my spasms are a little bit more, or I'm not sleeping quite as well as I did before, back it back off and then reevaluate at that point, and that's where your optimal dose is. Not necessarily taking more is better.
Jeff, thanks very much indeed. I'll send you a link so you can see yourself on TV.
Thank you very much.